You are listening to the Wellacopia podcast, part of the Invisible Not Broken network. I'm Eva Minkoff, your host and fibromyalgia warrior. I like to have candid conversations about chronic illness with both patients and practitioners. In other words, people. I'm also the founder of Wellacopia, the matching site for healthcare relationships. We connect wellness seekers like you with the integrative providers best suited to be your partners in care. Visit wellacopia.com to match with your dream doctor, nutritionist, therapist, and more. On today's episode, I interview the Sherlock Holmes of depression, psychiatrist and functional medicine doctor Achina Stein. As a board-certified psychiatrist for over 25 years, Dr. Stein's osteopathic roots set her apart from the conventional psychiatrists because of her use of the biopsychosocial approach paired with functional medicine, which has made her a diagnosis detective. Her son's psychological health crisis in 2010 was a catalyst for exploring functional medicine, then establishing her practice, Functional Mind, and now the release of her book, the whole reason I knew I had to have her on here, which is titled, What If It's Not Depression? Before we get started, just a reminder that all conversations and health claims on this podcast are based on individual experiences and expertise. Everyone has their own personal and professional truths and should be treated as such. Okay, let's get started. Good morning, Dr. Stein.
Hey, how you doing, Eva?
All is good over here. I'm so glad that you could join us today.
I really appreciate you inviting me. It was kind of serendipitous that we were having other conversations and it just came up, so.
Yeah, like we met not really having an intention of doing a podcast episode, but once I heard about what you're doing and your book, I was like, oh man, you need to come on right away.
Yeah, it was really exciting. So we really connected. It was nice. Yeah.
Awesome. Well, I'd love for you to start with your story from both a personal and professional standpoint in whatever way you'd like.
Okay. Let's see, where should I start? Well, in keeping with your perspective, I think, especially with chronic illness and finding ways to help people with chronic illness and connecting them to the, proper practitioners with Wellacopia, maybe I'll just start there. I am a psychiatrist, but I'm first an osteopathic physician. I was trained medically first, and then I did a psychiatric residency. And I practiced as a conventional psychiatrist for like 20 something years. And even though I was doing that for a number of years and seeing really, really sick people that were in the prison system and community mental health system, my world was turned upside down when my son became really, really ill. We were on a trip in France and India. We had taken the kids out of school, and my husband's a professor, and he was on sabbatical, so we decided to make it a long trip, and we took our kids out of school, all three of them, and this was back in 2010. And there was, towards the end of the trip, my son just became acutely depressed and suicidal. And long story short, he was literally, ready to jump off of a 5th floor building. And, just even saying that just makes me want to, it's like, that was 10 years ago and it still brings up a lot of feelings. But so long story short, we got him home, and I had to see a psychiatrist, a really good one, and he was put on 3 medications, one for depression, one for sleep, one for attention issues. He had a whole bunch of symptoms, not just depression. And at the time, it was really perplexing to me because he didn't just have a depression, and it came like literally out of the blue. It was not being able to think clearly. he had brain fog, and most importantly, most perplexing was the fact that he just couldn't even read anymore. And this is a kid who had a photographic memory and would read like lightning and remember everything, and he just couldn't even read anymore. And so it's like something else is going on here. I just knew something else was going on here. And this was sort of the same feeling that I had with a lot of my patients. Like I would get to a point where I'd get them to a point with what I knew, but there was something that I didn't know was happening, but I knew was happening, but I didn't know what it was, and trying to figure it out, trying to go through whatever I knew. And I knew there was something I didn't know. And around the same time that this happened with my son, I was actually looking for other types of training. And I was looking into integrative training out west with Tierra Low Dog and Teriona. I can never pronounce her name. Tierona Low Dog out west, and so I just happened to come upon serendipitously through making phone calls and looking into programs, come upon a practice called Visions Healthcare in Dedham, Massachusetts, which has since closed. And I was lucky enough to have the medical director there allow me to shadow him, and for I am forever grateful for that. And it was there that I learned about functional medicine. And when I brought my son there, so many things changed, and he just had a full functional medicine workup. And it was to the point where he was able to come off, and it took a progression of things improving, but it was over as early as 3 months. Some of his symptoms got significantly better, but it took up to I think it was like a year and a half for all of his symptoms to completely remit and come off of all of his medications. So, in that journey with him, I just learned so much. And once you know those things, you just can't turn back and go back to the way you were doing things. I just needed to know more. Unfortunately, they hired me there. I started working at Visions Healthcare. And, basically I became trained as a functional medicine provider. And I've been basically, treating all of my patients in the same way that he was treated. And I have a lot of patients that get better. Their depression and anxiety or whatever symptoms significantly improve. And, but it's, everyone's different. Everyone has a different journey, and depending on their constellation of symptoms, things take longer than others. And so, but that's basically what I've been doing now for the past 5 years. And it's all I do. And I also see patients for psychotherapy too, because I am trained as a psychotherapist as well. And so because there's so many people out there that need to know that there's another approach, I decided to write a book, and we'll talk about that some more later. But that's basically my journey. And the best thing about it is that I really also had my own health issues that I also resolved with the same approach as well. So
can you actually go into what functional medicine is a bit? Because I realize a lot of people don't know what functional medicine is, and we want them to.
Right. Well, it's really a lot of functional medicine practitioners do conventional medicine, and there's a layer of integrative medicine, where integrative medicine is using supplements and herbs and other modalities of treatment like acupuncture and massage, and it's adding alternative forms of care to resolve issues. But functional medicine is a layer even on top of that. Most functional medicine doctors do conventional medicine and the integrative medicine piece. But on top of that is functional medicine, where you get to the root cause of the problem. And it's sometimes is getting to the root cause of what's causing the symptoms, but then there's root causes of those as well. So you might have a symptom of depression, but there's invariably numerous root causes. And so conventional doctors or traditional classic, doctors or other practitioners who practice conventional medicine, know B12 deficiency, folate deficiency, hypothyroidism, there's are classic causes, medical causes of depression. And then and they might, like, let's say, prescribe an antidepressant, and an integrative doctor might prescribe or recommend St. John's wort, or omega-3 fish oil, whereas a functional medicine doctor might look for the causes, which usually resides in the gut lining. And so we treat the gut to treat the brain. And a lot of times people who have depression, as an example, actually a lot of problems actually reside in the gut. And that's basically the core. I feel like that's like the core thing that we do, is really look for everything as to what's going on in the gut that's not in order to treat other symptoms. Depression being one of them, anxiety, OCD, even fibromyalgia, chronic pain syndrome. So we try to improve the immune system. We improve increased gut permeability issues, and I don't know if your audience knows about that. It's also known as like leaky gut syndrome. And we support the immune system, basically try to get the immune system back online. So digestion and the immune system are two big things, because a lot of times things are caused by lots of inflammation in the body. So it's what's causing the inflammation in the body is really important, figuring that out and decreasing it in wherever you can. So that's looking at stress, hormones, infections, foods, and toxins. So the way to remember that would be the acronym SHIFT: stress, hormones, infections, foods, and toxins. So we look at those 5 areas to reduce inflammation. And then we really look at giving the body all the raw materials to fight inflammation. And that's healthy foods, healing foods, removing the inflammation, but, vitamins, minerals, phytonutrients, there's a lot of things that you can do to replace what the body needs in order for it to work efficiently as a machine, because it can heal and itself if you provide it, all the nutrients that it needs. And then a big part of it is re-inoculating the microbiome and bringing the microbiome back into balance, and then repairing the gut lining. And lastly, it's looking at rebalancing the whole body and figuring out from what went wrong in the beginning, in order to prevent it from happening again in the future.
Oh, that's thanks for taking us through that. I was able to really experience like what it would be like to work with a functional medicine doctor and all the investigating. That's so cool, because I think definitely for me and for a lot of us, we don't feel like we get that kind of attention where someone cares to dig deep, or really has the time, I guess, to dig deeper and get to that root. Because like you said, it's the figuring out the root cause and then the root cause of that root cause. And
Right.
It's like the question asking why, if you've ever done something like that. I love that activity when you ask someone like, why do you want this? And then you go, okay, well, why do you want that? And then it goes deeper, so you get to the root of your desires. I don't know if I love that activity, but it's the same with medicine in terms of root cause. So that's cool.
Absolutely. I mean, I've always been that way. I can even remember as a child, not a child, like a teenager, asking questions of a doctor. Well, why did I get this? And like, where did it come from? How did this happen? And there was like no answers, like they would just act as if they just didn't even hear your question, So I've always been that way, to try to figure out why something happened, and not just why, but why now? Like, why does someone gets sick, that has a certain number of symptoms, and another person who has the same symptoms doesn't. What does this other person have that this person doesn't have? So I'm always like thinking about those kinds of things, and it's just the way I operate. I've always been that way. Yeah.
Yeah, it makes sense that you went into this then for sure. What about actually, would you mind sharing a situation where when you ask yourself why that you really haven't been able to find an answer, or like what is it normally when it's truly a mystery for a while? Is there something that you do when I don't know, it becomes a dead end? I don't know if that's
Well, if I'm working with somebody and I come to a place where we're sort of like, what is that? When you're like you're just not moving forward,
oh
you're
yeah. Yeah, or like running in place or yeah,
yeah,
I know there's a term there.
there's a term for that, like that I'm not picking. Well, and
Hamster wheel?
but, huh?
Hamster wheel.
Hamster wheel, like you're on a hamster wheel and you're
Yeah.
not going anywhere, you're not moving forward, you're doing all of this stuff, and it's extremely frustrating, for not just the patient or the client, but also the practitioner.
Yeah.
And so what I usually do is I go back to the drawing board and start over. And
Mm.
because, when you have multiple areas, especially if you've like found in, so let me go back to what I do. So I basically put everything on a timeline about what happened from the very beginning of life, and sometimes even before a person's born. Because if their mother had some fetal, issues, issues while they were pregnant with the person, then that could certainly impact on some
Oh
level.
yeah.
So, but and now epigenetics is even showing, there's all this research about epigenetics and how what the mother experienced, even from a stress standpoint, can be experienced by the person who's born. So that all impacts on some level. And but I put everything on a timeline, and to find all the layers as clues for layers, and then obviously we have to start somewhere. So and I focus on really getting digestion in order, and focus on what's going on in the gut, and that's the second thing to get in order. But if we reach a point where things aren't moving forward and we hit a plateau, and the way I know this is by doing certain questionnaires, and we want to find certain symptoms to come down. But when we reach a plateau, it's like, okay, let's go back to our timeline and see what we didn't address, because you can only address certain things at a certain amount of things at once, because it can be overwhelming for that person to focus on so many things. So you kind of want to follow this progression. And so we go back to the beginning, and it's like, oh, this showed up on this test. And believe it or not, research and medicine, cutting edge medicine, is changing very rapidly, even from year to year. So if I did a test, let's say a year ago, and we addressed stuff, and then new information has come out on that test, and it's like, oh, we didn't address this. Now it's, we know we should address this in this way. And so we'll go back to that and address it, and things change. So it's going back to the drawing board, and it's like, maybe we missed something. And, sometimes your assessment of situations are as good as what the person tells you.
Yeah.
And so if they forgot to mention, or if I, ask a question a different way, it's like it triggers a memory. It's like, that's really relevant. I wish you told me that before. So it can really, change things, and change the path of even how we're going to address certain conditions. So I really go back to the drawing board and almost start over as if they're like a new patient. And obviously a lot of this takes time. The thing that I do differently with a lot of people is really provide the time and really be like a Sherlock Holmes, and to try to figure out what's going on with that person, and really finding those pieces of the puzzle to put together. And I used to not like saying Sherlock Holmes before, because Sherlock Holmes is a guy, and I know that there is this new modern female detective. But just recently in Korea, I think it's Korea, that there's this new series that came out called Sherlock Holmes, but she's a female Sherlock Holmes. And believe it or not, Sherlock is actually a female name that I did not know.
That is news to me. And someone with a British background, I feel like I should have known that, but all right. That's cool.
So, but anyway, so I would do that and, go back to the drawing board and try to figure out, well, maybe I missed something along the way. But certainly if I'm really, really hitting a wall, I would find somebody else to, consult with my patient, or actually even refer the patient to find someone for that person to work with that I know would most likely have the answer. I mean, that would be
Right.
the right thing.
Like every doctor has their own expertise, and even if they study the same specialty, people retain and have acquired different experiences. And I love it when doctors make a network so that they can sort of become a Sherlock Holmes group.
Exactly. Yeah, I'm actually part of these closed Facebook groups of other functional medicine practitioners across the country. And, we'll post, and I'll even say to the patient, you know what, I'm going to post, a case without identifying you on my Facebook group, and see what everyone else has to suggest. Maybe something will be right for you. And, and we post to each other, and we all comment and make suggestions. And sometimes it's hard, to tell the entire story, especially if you've been working with someone for a while. And some suggestions is like, yeah, we already thought of that. We already thought of that. But there might be one suggestion. It's like, oh, I didn't think of that. That's a good idea. So.
All it takes is one, right? So.
Right.
Actually, I'd love to dive deeper into where the patient-practitioner relationship is so important in this discovery process. Because, like you said, some people just won't mention things because they don't think it's important. And I don't even know how many times I've come across that. It happened in my own life with being diagnosed with fibromyalgia. I didn't know to tell doctors about the whole ballet thing because I was like, I had a great childhood. I didn't think being a dancer was relevant, except that we're almost certain, I don't know for sure, that it laid the whole foundation for me having fibro and hypermobility syndrome, if not like the direct cause. But I didn't know I should be telling my doctor that, or they didn't know the extent to which I was dancing, because I didn't say, oh, by the way, it's been 15 years and I did like 5 hours a day sometimes.
Right.
It's kind of important.
That's important. Yeah, you don't really realize, but it's also asking the question and maybe even asking the question again, in a different way. That's really important too. So
Yes. That's
yeah,
actually what happened with me in particular when the day I was diagnosed. My doctor said to me, because they had a feeling that I had fibro but didn't want to tell me yet, and they asked, did you have a traumatic childhood? Which I thought was a weird question, out of left field. And I was like, no, I had a great childhood, very happy. I'm still a very happy person. But then they had to pry. It was like, was there any kind of chronic stress that you experienced when you were young? Is there something that would make you upset on a regular basis? And then, because I have a love-hate relationship with ballet, I was like, oh, that. Yes.
Yeah. And it's the love-hate that's also
Mm-hmm.
important, that dynamic, really.
Drama.
Any type of conflict. It doesn't even have, so when people hear the word trauma, they think trauma like with a capital T,
Right.
sexual abuse. And it can be with a little t, or
Drama.
as simple as just conflict, just when there's conflict. So you had a conflict with ballet, right?
Yeah, that's
That can play
interesting.
out in your body.
Yeah, no one's ever actually identified it as a conflict, but that's absolutely true. It's still a conflict to this day. I've actually started doing a little bit of ballet again, and it's mostly been going well, and I'm working within my body's range. But yeah, it's a love-hate, probably always will be, both emotionally and physically. But yeah, I'm curious, do you have some stories like mine that you're open to sharing? So ones where it was like truly something a patient never would have, or was really hard to dig up?
Well, it's interesting um, because I'm a psychiatrist, I know how to draw sometimes those
Yeah.
kinds of things out. And I mean, because I actually look for these things too, actively look for these things. So what I look for are chronic feelings of guilt, chronic
Mhm.
feelings of shame, um, you know, dynamics in relationships that repeat themselves over and over and over again, self-hatred. Um, these are really intense feelings that a lot of people don't talk about. And believe it or not, that can significantly impact on your health. Significantly. And you don't have to even be like I do this questionnaire called the ACE score. Are you familiar with that?
That sounds very familiar.
Adverse childhood events.
Yeah, yeah. Hmm.
So like that kind of picks up on the major stuff that can happen in terms of like abuse. It does pick up on what's happening in the household when you're a child on some level, but you can also develop um, ideas just because of the way you draw conclusions. For example, I've had a patient that had an intense thing happen in his house where um, his father collapsed and he was 5 years old. And his mother began crying, and the child at 5 took it upon himself to try to protect his mother. And because he was sent to his room, because I'm assuming, I don't know because I never talked to his mom, I'm assuming that this she sent him to his room to protect him,
Right.
right?
Hmm.
But he took it as, I failed. I failed to protect you and you rejected me, you know. And then every dynamic after that kind of is played out. Every relationship is, I'm a failure. I'm not good enough. I don't, I didn't, those thoughts can really play. I mean, there are a lot of people who have feelings like I'm not good enough or I failed, but it can play to an intense depth in every relationship and everything that you do, that it then becomes like it defines you, and that can be expressed in physical symptoms. So it is those kinds of things are what I look for, because they tend not, especially if someone who is not getting anywhere in terms of, they get to a point and they plateau. Those kinds of thoughts and feelings and core feelings about themselves can really impact on how you do from a health standpoint.
And this is where you use what's known as the biopsychosocial approach, right?
Hmm.
Actually, can you talk about that a little bit? I mean, it's sort of explained in the word itself, biopsychosocial, but
Right. Yeah, well, the biopsychosocial approach is actually a conventional psychiatrist approach. And it is something that Paul Fink, he's a physician who, I don't think he's the only person who's written about it, but there's lots of papers about that approach. And it is looking at the biology of the person, the psychology, and the social, and how they all interact. And so I think that's a great approach, but I take functional medicine kind of takes it one step further in the biology piece, because we're looking at physiology, cell biology, looking at, cellular, on a cellular level, and how um, all of the different systems interact with each other, in the body, not just looking at specific organs and just focusing on that organ and forgetting about the rest of the body.
right, not pro that per se.
Yes. Yeah.
There's a time and a place for just looking at one organ, I guess, but generally speaking, actually, I don't know. I don't like to make sweeping statements, but I think it's always important to know about the person's whole body and the person's whole world. And
Absolutely.
I also feel that there are more succinct ways to do that, but we'll get into that now.
Yeah.
Actually, what I would like to get into is, well, what's also the title of your book, What If It's Not Depression? Uh, that's such an amazing title. First of all, if you be like, Okay, so what if it's not depression? What does that mean? So yeah, please share that with us.
Oh, wow.
I guess without, giving away the entire book, but I'd love to know where that came from. Like, yeah, what spurred you to write about that, and what is it that you uncovered?
Yeah. It took me a long time to get to that place. I've been in the process of writing this book for 2 years. And, the word depression just, it means so many things, right? So it is a symptom. And what's happened in over decades is that um, it is a symptom of that's used by a lot of people, I think sometimes inappropriately, because it's more of a clinical word. And oh, I'm so depressed, as opposed to I'm frustrated, I'm sad, I'm despondent, I'm angry, I'm afraid, like words that actually are defining specific emotions. And so sometimes that word "I'm depressed" comes across as a clinical thing. And then people assume that what they're experiencing is depression because of what they've heard of and because what's on TV, and right. And so that is a word that I would love to remove as as a description of an emotion,
Hmm.
and but it is a feeling, sad, or having a lack of pleasure. From the definition of clinical depression, is having sadness or a lack of pleasure for at least 2 weeks. And it's usually accompanied by all of these physical symptoms, right? And then it's given a diagnosis of, let's say, dysthymia. I mean, there's a number of diagnoses under the mood disorders, but let's say dysthymia or major depression. And what typically happens is that there's this assumption that this is a medical disorder, as opposed to a clinical syndrome, and this disorder or syndrome is then prescribed a medication. Okay. As opposed to looking at, well, maybe this is a medical disorder that happens to have the symptom of depression accompanying it, right? And maybe an antidepressant is not the most appropriate thing. And technically, part of the DSM-5 indicates that you should rule out all medical causes. And, basically that approach has been watered down significantly, because I'm finding that so many people that end up coming to my practice have never had any blood work. They might, and they've seen psychiatrists, so sometimes the psychiatrist thinks that their primary care physician has done the blood work to rule out medical causes. Primary care physician thinks that the psychiatrist will do it and make sure that all the medical causes have been ruled out. Or you'll have a psychotherapist that then communicates to the pediatrician or the family doctor and says, oh, this person has severe depression and they need an antidepressant, right? There's different avenues where people are put on medication, and the medical causes are never sought. I had a patient here recently who's been seeing a psychiatrist for a year now. She saw a therapist for 2 years, and neither one of them had done any blood work at all.
Wow.
Not at all. And that to me is really, that's not even doing the standard of care. Okay. Not doing any blood work to rule out medical causes is to me is egregious. And just putting her, so now she's on 3 medications. She's on Wellbutrin, which was increased to a higher dose. Then she was lamotrigine was added, and then Prozac just 3 weeks ago was added. So she's on 3 medications.
Three intense medications.
Right, she's on. Yeah, and no blood work's been done. That I'm getting I'm getting a little upset about it, but it just makes me so angry. It really does when that even the standard of care is not done. So I do talk about that, but think about how maybe this person has a medical diagnosis that causes depression, but there's so many problems like fibromyalgia and autoimmune disease and chronic pain that have accompanying symptoms of depression, but that's due to inflammation. So and then these antidepressants are used to treat a lot of things, not just depression. So when I talk about what if it's not depression, well, what if it's not this clinical syndrome of depression, and it's something else that really needs to be searched for more than the basic blood work that's done, because sometimes people have blood work done and they're told it's all normal. So, and there's different things I could say about that, So the blood work's not interpreted. It's not all the blood work's done. There's so many causes of depression that not all the blood work's done. If it is done, it's not interpreted properly, and then there's no recourse. So other than just, okay, well, everything's normal, it must be in your head, and here's an antidepressant. And so now I don't mean to minimize at all that there are people who have severe clinical depression that absolutely 100% need to be on an antidepressant. That's on the other extreme, where they're suicidal. My son was put on antidepressants immediately, and I would have done it exactly the same way, even if I was a functional medicine doctor at the time that this all happened. So, and I've been on an antidepressant, when I had my Hashimoto's thyroiditis diagnosis, I had Epstein-Barr at the same time, and I was put on Wellbutrin, and only recently have been tapered off of that medication. And I had this huge withdrawal with it that it took me literally years to come off of that medication. Wow. So it is something where I think there is a place for medications, and it be given when it's absolutely necessary. And if that medication is started, to then look for the root causes, so at some point you can come off the medications. So because now research is showing that there's a lot of issues with being on medications long term. And so I think that ideally the best approach would be to have almost like this yin yang relationship between conventional medicine and functional medicine. In the same way, you have an emergency, right? And you deal with an emergency, and then, okay, we stabilize the emergency. Let's figure out what happened, and fix that, bring the body back into balance, so you don't need to be on medication long term. To me, ideally, that's the way medicine should be practiced.
And I agree. Can you paint maybe a clearer picture of the difference between the extremes? So for instance, like I know so many people with clinical depression and anxiety, and people that have really had the classic and severe symptoms of clinical depression. So what does it look like when it's a difference? Is that something that you can articulate? So when someone is actually severely clinically depressed versus when they are having severe symptoms of depression. I'll give you a little context actually on my end, so I don't talk about anyone else. For a period of 2.5 years, I suffered from, I guess you could say, depressive episode, like behaviorally induced. I have never been diagnosed with clinical depression, and I definitely do not feel like I am depressed. But for that period of time, I had something happened that was a catalyst for feeling depressed for a long time. So that was a long period of time, right? It was 2.5 years, definitely more than 2 weeks. But I know that I wasn't clinically depressed, but people thought I was because of the longevity of it and symptoms that I was feeling. So maybe in my case, if someone came to you that way, what would you have to say about that? Um, or even if I did identify with clinical depression at that point, what would you have said?
Uh, that's that, I would have to look at all the layers. So I would
I guess
search
that's true.
for layers, right? I mean, think about it this way. I mean, if you looked at a person and everything that's affected from the outside in, right? Do you have a sense of purpose? Right? Right? Are you able to connect to people? Um, just those two things can cause someone to be depressed, right? Do you feel like you have meaning in your life? uh, you know, if you think about Buddha and Jesus, right? They sat alone for long periods of time to sort of work those things out. And I mean, they were probably depressed, right, during those times, So, sometimes depression or having a sense of that life is not, something's not right in life, it, you have to sit with it and work through it in order to grow from the process. And there are people who might look at you from the outside based on your symptoms, the syndrome that you might be experiencing, as being a clinical depression, and then your mind is put off track. Oh, this is medical, this is clinical, it's not me trying to work something out and figure out who I am, right? And then you end up getting off that track for a period of time, and that could be, you're losing that opportunity. Now, sometimes people have a really hard time just being with their feelings and working through them. They think, they are afraid of them or feel guilty about them, feel shame about them, right? And so working through these emotions are really, really important. So so there's these different layers, and then it has to do with stresses, right? Stress in relationships, stress on your job. Maybe your job is killing you. Maybe you have a toxic boss. Maybe, so then, there's impact to your body. So if you go from the outside in, all of these different layers is what I look for and address them differently. So I've had spiritual conversations with people about spirituality and meaning of life. I've had conversations about the head trauma that they had that impacted, their gut, that then caused them to have depression. So when I'm talking about, head trauma, concussions, and things like that. So and or even just emotional trauma. I mean, that's my expertise in terms of psychotherapy. I have patients that have dissociative disorders and mood disorders because of their emotional trauma and other types of trauma, and how that impacts on their life, and changing their perspective and how to cope, and how it changes how they feel about themselves as a person. So all of these different layers are things that honestly antidepressants don't really address, other than changing your neurotransmitters temporarily. And if those stressors remain on high, then they're not going to be impacted by an antidepressant. So many people have these issues that I just talked about that an antidepressant doesn't address.
Yeah.
Having a midlife crisis is not going to be changed by an antidepressant. So it might a little bit, in the same way, like alcohol can change, how someone feels, but at some point that problem is still there. So I'm trying to answer your question. I don't know if I really answered your question, because it's so complicated and complex that I think it needs to open up a conversation in terms of what's going on with a person, and bringing all of those cards on the table and looking at how it all interacts, and starting first of all with safety. The most important thing is to make sure that person is safe. So a clinical depression that causes, that's including auditory hallucinations, or visual hallucinations, or command hallucinations, and suicidal ideation, especially if there's an intent to plan. My first priority is to make sure that they're safe. And then the second priority, if that needs to be, is do they need to be in a hospital to keep them safe, and potentially starting them on medication. So everything's on a continuum. I mean, I'm sure even with fibromyalgia, there's different fibromyalgia is on a continuum,
Oh,
right?
yeah, absolutely.
So I think if you look at it at everything as being on a continuum, and there's people who are on different places on that line, you're going to address things based on where they're at, and it's going to be a conversation with them about what they want to do. And I might say, look, you really, really need to do this because X, Y, and Z, but ultimately it comes down to them, unless obviously they want to kill themselves. I mean, then I have to step in, but there has to be a respectful conversation and a back and forth conversation about all of the possibilities, and in terms of addressing the root causes of the depression. And so psychotherapy is definitely going to be a part of that. But again, as a psychiatrist that prescribes medication, and when needed, because I don't prescribe medications as much anymore, but I still do. Certainly, like I would say maybe 10% now compared to years ago. But psychotherapy is a big part of the way I address issues, and diagnostically as well as in doing therapy. But then the functional medicine piece is really what gets things moving to a place of healing. That's what really makes the difference.
Yeah. And I know you mentioned this earlier, that it going down the levels can also include gestationally. So like when the mother is pregnant with that person. I was thinking though about people I know who were diagnosed with clinical depression at a very young age, who, I mean, to their knowledge, were not traumatized. I mean, like they were diagnosed, let's say, at 8 years old, but they had had symptoms since they were 3. You know, like
Yeah.
those things always trouble me, because I know that there are a lot of things we don't know and maybe can't know, whether it be about their mother and the kind of stress, or something that happened to them when they were a baby, when they don't know.
Right.
But I guess in those situations where there's no obvious information, so I'm really like directing like the
Yeah.
difficult.
Well, this one patient comes to mind, and he actually started to see me because he was having panic attacks,
Mhm.
and he had a difficult childhood and a strange relationship with his mother, and he had always had this low level of depression, and kind of just thought, oh, this is just like kind of like my personality, this is just the way I am, and never really sought treatment for it because it's just been there like since he was 5. and so when I treated him for his panic attacks, treated his gut in the way I explained the 5 R's, I had a session with him one day, and he said, my depression is getting better, and I've been feeling joy. I've never felt joy before, and I just thought that was just who I was, and I'm experiencing joy. And he gave a little story about it. It's like, yep, that's joy.
Wow.
It's so I've been finding that people do change. I've had I've had some patients where when they start seeing us, they can be really nasty, and sometimes in the beginning, especially to my office manager, and then like 3 months later, my office manager is like, wow, she was really nice to me. It's like things are
Yeah.
So it's people's personalities change think in the way that they never imagined. So even though that they come to me to address specific issues, they get so many other benefits along the way that they didn't even anticipate.
Yeah, because you're treating the whole body and the whole mind.
Yeah, yeah,
That's great.
yeah. So I think it is. It's amazing. I'm always surprised at how well people do, and I'm always high fiving and my patients and doing a little happy dance when they say like their depression. I had a patient who came in with her mom the other day, and I saw mom in the first session with patient because she's in college, and a lot of times the college students don't really know about the early part of their childhood. So, and then after that, the mom would not come in, and I would just have the session with patient. And then 6 months later, so I started seeing her in June, and then just this earlier this week, mom came in, and she just started crying. And I said, what's wrong? And she goes, I just wanted to express to you how much you've done. And she was so happy and had joy with tears about her getting her daughter back in 6 months. And she was a girl that had lots of severe depression with suicidal ideations. So I really I really see so many people get well with this approach. And I'm not saying that there aren't people who don't, because there's so many variables. But I think if you do the work, it's work. Changing your diet, changing your lifestyle. It really is work. But I think the other part of it is saying, do I still want to live this way? Really looking at your life and wanting to make those kinds of changes is something that has to be decided by that person.
Right. Well, thank you so much for shedding light on something that can be very dark.
Right.
It's I don't know if I've ever looked at depression with such hope.
Mm-hmm.
So really thank you so much for coming on and sharing all of your experience and knowledge and insight with us. It's been really special.
Oh, I really, really appreciate it. I really want people to know that there's lots of hope to getting better. There are definitely other ways of addressing issues than than the conventional way. And certainly there's a place for the conventional way, but there's other ways as well if that's not working for you. So don't lose hope. Find the right people to help you.
Thank you.
Thank you.
Thanks for listening to another episode of the Wellacopia podcast, part of the Invisible Not Broken Network. If you haven't already, please take the next 30 seconds to do these 3 things. Hit our subscribe button, tap those stars to give us a rating, or even better, a review, and share this episode with a loved one. If you're interested in working with Dr. Stein and want a free copy of her book, send her an email with "I want to work with you" in the subject line. She'll send you the book and set up a time to talk. Her email address is astein@healthyselfbootcamp.com. Of course, I'll add that in the show notes. You can also check out her Facebook group, which is called "What If It's Not Depression" as well. If you're also interested in some chronic illness specific inspiration on a weekly basis, sign up for our WellSpo weekly newsletter. WellSpo stands for Wellness Inspiration, by the way. Each week on Friday afternoons, we'll send you a short email that links to uplifting stories, summaries of new research, giggle-worthy memes, and more. You can sign up for the newsletter on wellacopia.com if you scroll to the bottom of our homepage, or blog.wellacopia.com/newsletter, and both links will be in the show notes. If you ever want to submit a question or suggestion, feel free to send an email to chronicillnesspodcast@gmail.com. Thank you again for tuning in to the Wellacopia podcast. Be kind, be gentle, and be badass.